Today, let's discuss about endocrine cancer with Dr. Anil Kamath. He is a senior surgical oncologist. Hello, doctor. What is endocrine cancer?
Yeah, I think you're referring to the neuroendocrine cancers. Now, neuroendocrine cancer, it's a pathological diagnosis. It's a separate set of tumors where the behavior is quite different from the regular cancers in most of the cases. In some cases where it is high grade, the behavior can be similar to the regular type of cancer. But when we talk of the classical neuroendocrine cancers, they are usually low grade. They tend to be there for a long period of time before giving symptoms. So that is one this thing. It can happen anywhere in the body, anywhere in the gastrointestinal system, stomach. Pancreas is a common site for a neuroendocrine tumor. It also happens outside the gastrointestinal system, like in the lungs also. Now, this tumor, the speciality is its slow growth, especially for grade 1 neuroendocrine tumors. The growth can happen over many months or years, and the pathological features are very specific to these neuroendocrine cancers.
How we can diagnose neuroendocrine cancer?
Most of the time, these are diagnosed when the patient doesn't have adequate symptoms. You do a CT scan for some other reason, you find a tumor in the pancreas. There is a high likelihood that this is a neuroendocrine tumor. Since they are slow growing, it takes a long time before they produce symptoms. Later on, when we take the biopsy, the pathologist is the one who confirms that there is a neuroendocrine tumor or a cancer. This is dependent on special stains done on the biopsy specimen. If it is chromogranin positive, then we tend to call it as a neuroendocrine tumor.
Doctor, what are the symptoms of neuroendocrine cancer?
Neuroendocrine cancers can be totally asymptomatic since they are very slow growing. It can be detected incidentally, that is, when the scan is done for some other reason and then we detect that there is a tumor. But depending on the location, they can produce symptoms also. One very important feature of neuroendocrine tumors is that they can secrete hormones. It is endocrine, means hormone secreting. Not all neuroendocrine tumors are hormone secreting, but some of those, especially the ones in the pancreas, these can secrete excess hormone secretion. Like gastrin is a hormone which is produced, which causes increased acidity. Insulin is another hormone by the pancreas, normally required to maintain the sugar, but excessive secretion by neuroendocrine tumors producing insulin can cause symptoms. Similarly, there are many other hormone producing tumors. So these are the common symptoms of neuroendocrine cancer.
What is the treatment for neuroendocrine cancer?
Yeah, the treatment will depend on the stage of the neuroendocrine tumors or cancers and the location in which organ it is located. Now, there is a spectrum of treatment. In very early small tumors, even there is a role for observation. Since these tumors are not fast growing, in certain cases we may just tell the patient to follow up and observe if the tumor is growing. Surgery forms the more important treatment for larger tumors which are more likely to give problems. Chemotherapy has got very less role, as by and large these tumors are not chemosensitive. There are some chemotherapies which are coming up, especially immunotherapy and other such things. But there are other injections, like there is an injection known as sandostatin or octreotide, which is used in the treatment of tumors which can't be resected in the for this one. And then there is another treatment which is given by our nuclear medicine colleagues, what is known as the lutetium dotatate treatment. And this basically is an injection, and the substance concentrates wherever there is this neuroendocrine tumor and destroys it there. So these are the various treatments available for neuroendocrine tumors.